Hi, good morning, Victor. My name is Mihira. I'm your invigilator for the OIT speaking session on the 3rd of July 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name, for the record, please?
My full name is Victor Rosalie.
And what is your candidate number?
My candidate number is 4731044731.
Okay. Are you taking this test as a nurse?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Can you tell me more about your experience as a nurse practitioner?
I have been working as a nurse practitioner for 5 years, mainly in the family medicine setting. I see patients of all ages and backgrounds, with various acute and chronic conditions. I perform physical exams, order and interpret lab tests and imaging studies, diagnose and manage diseases, prescribe medications and therapies, and provide health education and counseling. I also collaborate with physicians and other healthcare providers to ensure continuity and quality of care. I enjoy building rapport with my patients and helping them achieve their health goals.
Describe the abilities you have to work as a nurse practitioner.
As a nurse practitioner, I have the skills to listen and comprehend spoken words and sentences, to speak clearly and convey information and ideas to others, and to identify problems or potential problems. I can also synthesize information from different sources and draw general rules or conclusions, as well as find connections among seemingly unrelated events. Moreover, I can read and understand written information and ideas.
What are some challenges you face as a nurse practitioner?
Some of the challenges I face as a nurse practitioner are keeping up with the latest evidence and guidelines in my field, and staying current with my certification and license requirements, working in a fast-paced and sometimes stressful environment, where I have to balance multiple demands and prioritize patient needs, dealing with complex or difficult cases that require consultation or referral, communicating effectively with patients who have different levels of health literacy, cultural backgrounds, or preferences, and advocating for my role and scope of practice as a nurse practitioner, especially in states where there are restrictions or barriers to a nurse practitioner practice.
How do you see the role of technology evolving in nursing practice?
Technology refers to tools and devices that help nurses with patient care. Technology can improve care quality and efficiency, enable new care models, empower patients, facilitate collaboration and communication, and support nursing education and learning. Technology can also pose challenges such as ethical and legal issues, new skills and competencies, nurse-patient relationship, patient barriers or disparities, and nurse stress or burnout. Nurses need to be aware of the benefits and risks of technology, and be prepared to adapt to the healthcare system. Nurses also need to be involved in the technology design, development, evaluation, and implementation.
Can you tell me more about the role of social media in nursing practice?
Social media is a term that refers to online platforms and applications that allow communication and information sharing. Social media can have positive impacts on nursing practice, such as professional development, education, networking, advocacy, patient engagement, education, and empowerment. Social media can also have negative impacts on nursing practice, such as ethical, legal, and professional risks, and effects on the nurse-patient relationship and the public image of nursing. Nurses need to use social media properly and follow the guidelines and best practices for using social media in a responsible and ethical manner.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your power to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Well, Mihira, from my observation, I can confirm that he has a bee sting on his arm. Mihira, do you notice any other reactions he has to sting?
Yes, he has been crying a lot and scratching it. It's obviously itching and painful for him.
Yes, it would be. Did he have nausea or vomiting?
No, he hasn't vomited or had any other reaction.
Okay. Did he experience breathlessness?
No, he breathes normally.
Good. Mihira, I would like to know if you have given any treatment for Jake for sting.
Nurse, I didn't know what cream would be best, so I didn't use any. I gave him some paracetamol for the pain, though.
Okay. Does Jake have any history of allergic reactions to anything, like food or medicines, or insect bites?
No, not that I'm aware of. This is the first time he has been stung by a bee.
Thank you for sharing this information with me. let me repeat what you told me, to make sure I understood everything correctly. You said that Jake has a bee sting on his arm, and he has been crying and scratching it, because it is itching and painful. He has not had any nausea, vomiting, or breathlessness. You gave him some paracetamol for the pain, but no other treatment. He has no history of allergic reactions to anything. Is that right?
Yes, that's right.
Okay, thank you for confirming that. Well, it looks like he has a mild allergic reaction to the bee venom, which is causing the swelling and the itching. Nothing to be overly concerned about. It's not uncommon in children of his age.
Okay.
Mihira, let me explain to you what we are going to do for Jake. We can give him some antihistamines to reduce the swelling and prevent any further symptoms. We can also apply some soothing cream to the sting area to relieve the discomfort.
Okay, thank you. So, will he be okay then? Do you think he should stay in the hospital until the swelling goes down? He's so young, I'm worried about him.
I understand your concern, but there's no need to worry too much. Most bee stings are not serious and don't require hospital admission. We only admit patients who have a severe allergic reaction, which can cause breathlessness, low blood pressure, or shock.
Oh, I see.
Here, Jake doesn't have any of those signs, so he should be fine. However, we won't discharge him until we see a reduction in the swelling and confirm that he has no other symptoms. We'll also monitor his vital signs and observe him for any changes.
Okay, that sounds reasonable. How long do you think that will take?
Yes, I can understand a mother's anxiety. Perhaps, I am sorry to say the exact time for the changes to happen. It depends on how he responds to the treatment, but usually it takes a few hours.
All right, nurse. Thank you for your help.
You're welcome. Mihira, the doctor will see him as soon as possible and give you more information after his examination.
Okay, that's fine.
Mihira, meanwhile, if you have any questions or concerns, please let me know. I'll be back to check on Jake soon.
Sure, nurse, I will.
That's perfect. I wish him a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.